So let's start from the very beginning, which is thinking about and purchasing a plan. So Leslie, I will, be relying on your expertise for this. Before we talk about like any of the specifics of the plan, why would an international student shop for health insurance while they're studying?
Yeah, so it's important to understand that for F1 students, health insurance is not a government or legal requirement, but many universities or colleges do require it um, and won't let you study without proof of insurance. There are some schools that don't require it but recommend it, and I'm here to tell you that you should have it, even if it's not required. It's something that you really need in the U.S. Um, but it's important to understand what your school's policies are. Every school has its own policy and way that they handle insurance. But overall, there's 4 different types of insurance requirements that your school might have, one of these 4. There's mandatory, which means that you have no choice but to choose the school's insurance policy that they offer.
Mhm.
There's mandatory with waiver, which is like the last one, but there is an option to opt out if you find your own plan that meets certain requirements within those waiver requirements. Then there's mandatory choice, which would be you're required to have an insurance plan, but you can choose your own plan. Usually the school will have a set of requirements within that, but it's not a waiver. You can just choose a plan. And then optional, which is when a school says, yeah, we recommend that you have it, and you can basically choose any plan that you qualify for. So those are the four options that you might run into depending on what school you go to.
Gotcha. So it sounds like you might have a couple different choices, anything from there's just one that the school offers and that's your choice, to optional and you can choose any plan you qualify for. But no matter what, it sounds like generally you have to have a plan of some sort based
Yeah.
on university policy. Gotcha. Makes sense. And then, so if all students pretty much need health insurance, what is the deadline or timeline that they should be aware of when maybe going through like preparing to study abroad?
Yeah, so the timeline, like the other question, is really going to depend on your school.
Mhm.
Um, so some schools want you to show proof of insurance as early as the admissions process, while others will want to see it once you get to campus. So again,
Mhm.
it's important to know what your school's policy is so that you are following those directions and not missing any deadlines. But generally speaking, it's a good idea to start looking at insurance plans when you start applying to schools. Um, and the cost of insurance is going to be included in that total cost that you have to show and prove on your I-20. And so knowing what to expect in reality is going to be really helpful for that.
Gotcha.
And then your plan should start on the day you arrive in the United States.
Mhm.
And this is an important, this is why you don't really want to wait until you get here because something could happen. You could walk off the plane and get hurt. And so we want to make sure you are covered from the moment you set foot in US soil. So make sure you have a plan that starts on the day that you are here. Worst case scenario, no later than the first day of classes. And then again, your school might require proof of insurance before departure. In that case, you can still purchase it to start on the day that you arrive, but you'll still have proof of it prior to that. And again, you can wait till you're in the US, but you'll have that window of time where you're not covered, which we don't recommend.
Gotcha. Gotcha. Yeah. So two really important things I heard there, which is that your health insurance cost should be factored into your I-20. For audience members, that have already gone through the visa process, you're familiar with that. Anyone studying in the United States that hasn't or is yet to, that I-20 is an important document that not having to reissue it, definitely preferential. And the second is any gap in coverage is a potentially unsafe gap. So Arbaaz, do those resonate with you? I mean, would you suggest health insurance for international students?
Well, as Leslie mentioned, that it's mandated by the university. So, yes, of course, I would make that suggestion. But in my case, I think it was the one where the school told me, you know what, this is the
Hmm.
insurance you have to buy. this is how much the cost is. Go ahead and buy it and send us the proof, or pay us the money and we will transfer it off. So for me, the cost of the insurance was not a separate one. I paid it with my tuition fee, something that you also mentioned that it was factored into that I-20 cost. But surprisingly, I did not know that it's not mandated by the law, because the stories that we hear about the insurance and back home as well, while we're preparing to come to US, they're all like the way they make the whole insurance thing, a scheme thing is that, oh, you know what, it's a government regulated aspect of the whole journey and you need to be paying attention to it. I definitely took one, and we'll talk a little bit about my experience as well in the call. But to be honest, I had very little knowledge on how to use the insurance plan, primarily because I come from a country where healthcare costs aren't really exorbitantly high. So optional, like insurance is an optional thing. If you want, you can go for some expensive procedures, but otherwise for a day-to-day regular doctor visits, you might not need one. So it was, and I think Indian students constitute the maximum, or at least one of the maximum student populations in the US, and a lot of them would have similar experiences, I imagine. So, and plus there are some other countries as well which might have a similar situations, but we'll talk more on those things as we progress. But yeah, I think all of these things resonate with my experience too. Might be slightly differently, but I am checking the boxes mentally as Leslie's talking about the insurance plans and the journey ahead.
Yeah, totally. Thanks for your insight. And I'll just ask, you mentioned the sort of different costs of healthcare here versus in India. So when we talk about healthcare costs, or what it might, cost for either a doctor's visit or even a hospital visit, Leslie, what kind of scale of expense or what kind of scale of costs could we think about for maybe an ambulance visit or broken arm, something like that?
Yeah, so it's hard to make like a generalization about how much it might cost for you specifically, depending on what plan you have. But we can talk about what the cost might look like without insurance. Ambulance rides can start in the thousands. So, I would say anywhere between $2,000 and $5,000 just for calling an ambulance. I know I've talked to a student before who was saying I called an ambulance and they didn't even take me anywhere. They just came and I didn't need to actually go, and I'm still getting a bill for it. And unfortunately, that might be the case. You could always try to argue for that, but that's sort of the way healthcare costs work. Ambulances are not free in the US. But if you have insurance, then that is something that is part of what gets covered, are things like ambulance rides. And then broken arm, I mean, that could be just to go to the emergency room and have it set, and x-rays and all of that. You could be looking at anywhere, starting at $10,000 going up. And if you require surgery, then we're getting into the $25,000 plus range. So these are large numbers that you're dealing with. If you get in a car accident and have major injuries, you could be looking at hundreds of thousands of dollars of hospital bills. And so this is why having insurance is critical in the United States. Even if you're super healthy, even if you're a super careful person, there's a lot of accidents and injuries that you just can't predict. And we want to make sure you're safe and not in a situation where you have a bunch of medical debt.
Totally. Makes sense. That's what insurance is all about, right? Yeah.
Exactly.
But yeah, so those are some high ticket costs, which is, just wanted to underscore how important it is that you get your health insurance set up so you don't have that window of no coverage when you get to the United States, so that you are able to seamlessly start your coverage. But this kind of leads me into my next point, which is when you're shopping for plans and you're looking for that coverage for student insurance, what are some things to like just keep in mind while comparing plans and going through that shopping process?
Yeah, so things that you're going to want to look for, make sure your plan covers. So this is for students who have an option. So if you have to take your school plan, then that's what you take and you don't worry about it and you can trust that it's a good plan. But if you are choosing a plan, these are things you want to look for. Does it cover doctor's visits and hospitalizations, prescriptions, Mental health coverage is super important these days and is often a separate thing, so look for that specifically. If you are an athlete, organized sports, if you are someone who will be doing like recreational sports or intramural sports, make sure there's coverage for that. Or if you're like a collegiate athlete, intercollegiate, make sure there's coverage for that. Pre-existing conditions, I know that was a question, so we can talk more about that, but does it cover that? And if so, is there a waiting period before it will cover that? Maternity coverage, if that's something that might that might happen to you or that it's on your radar, you want to make sure there's maternity coverage. Emergency medical evacuation and repatriation. These are two really important factors for international students. Emergency medical evacuation refers to if you need to be medically evacuated to your home country to receive care and to be home. And repatriation refers to if you unfortunately obviously pass away in the US, it's getting your body back home. And that's super important because if you don't have insurance for that, then your family is strapped with those costs and it can be extremely expensive, like in the $25,000 plus range. So you want to make sure you have coverage for that. And then there's terms that you want to look for. Premium, you want to see what that is. That's the either monthly or annual cost that you'll be paying to actually receive the benefits. Out-of-pocket costs include things like deductible, copay, coinsurance, and then out-of-pocket maximum. I'm not going into what all of these are, but you want to be able to look and see what these look like because that's going to determine your regular out-of-pocket costs. And then in-network versus out-of-network coverage. So usually the way insurance works in the US, in-network coverage is going to be the most affordable option. We'll talk more about how to use that in a minute. And then any hidden limits. So if it says, mental health coverage, yes, mental health is covered, but up to what point? Is there a limit of number of visits? Is there a dollar amount that at which point you'll stop paying? So make sure you look at all of those details. And then also you want to check exclusions. So there's always a long list of exclusions for every plan, just for legal purposes. But make sure you look, if you have something that you deal with, look and make sure that that's not an exclusion. Common ones include wellness and preventative care. We encourage you, if possible, to take care of that in your home country, where it's most likely free or more affordable. Dental and vision is usually separate. We do have those options, but they're not usually included on the health plans. And then sports-related injuries are often excluded.
Gotcha. Makes sense. So it's a long list, but don't worry, guys. We have a checklist that we'll send out in the follow-up email to this webinar with those things detailed. And let's see. So guys, so I think, Leslie, thinking about that, obviously repatriation, medical evacuation, those are sort of specific to international students or, traveling overseas. A lot of the other sounds a lot like you're kind of similar to like an American healthcare plan. But Arbaaz, I think there are a couple factors that, because international students are living a very specific kind of lifestyle, that their health insurance, they might think about specifically when finding a policy. Can you speak a little bit about like what some of those items might be?
Sure thing. I think one of those items should be the medical evacuation, as Leslie mentioned, definitely. I also saw a few of my classmates, they came, they were already married by the time they got into their MBA program. So they came with their spouse, their kids, and I'm assuming that would factor or that would affect the insurance coverage, the plan, in some, or the cost in some way. And Leslie, maybe you could draw some light onto that part as well. And I think since these health insurance plans are very different from those employers' health insurance policies, which every employee would get in the US, I'm assuming that there's going to be a bit of a renewal process that comes into play, which wherein you can actually either choose one different plan that you have to go with if your university provides you that option, or else you might want to give some confirmation to your insurance provider that, hey, I'm open to renewing the plan for the next year as well. But I'm assuming those are certain things which you need to at least do, because the year gap between May to August, you don't want to be stuck in during that time without an insurance. Because the time is that, I mean, I got into an accident right about that time. So I know this is the time when you want to go out, meet with friends, travel and everything. And that's kind of makes you a little prone to the injury. Thankfully, I had my insurance, so I definitely used it. But those important aspects of, you know, the school-less time, you still want to be covered, and you want to make sure that your insurance actually provides that for you. But that's what comes to my mind. Leslie, help me here if I forgot anything or if I didn't explain any of them properly.
No, I think that's great. All of our plans do include repatriation and medical evacuation because we're called international student insurance. We literally, curate and create insurance plans specifically for international students. So they all cater to those needs. And you are right, we also have plans that cover dependents because many people are coming with their families. So whether that's spouse or children or both, we have plans that either if the student is on the plan, they can add on their dependents, or there's plans that dependents can be on independently of the student. So we have a lot of different options for that. And then for your point about renewability, it's super important that you have a plan that can be renewed up to the entire time that you're going to be studying, because what you just mentioned about making sure you're covered from, between May and August. Some of you might be thinking, well, I'm going home. I'm going to be back in my home country during that time. So why does it matter? Well, I know it feels silly to be paying for insurance if you're not even in the US, but one thing is our plans work anywhere outside of your home country. So if you're traveling anywhere, even that's not home, then the plan will still cover you. And then the other thing is that it's really important to have continuous coverage if possible, because if you have a plan and then it ends in May and you start a new plan in August, anything that you received care for prior to that is going to be considered a pre-existing condition. And so you will have to start over. If you have a plan with a waiting period, you'll have to start that period over for anything that you received care for previously. So having continuous coverage is recommended, even if it means you're going to be paying for a few months that you might not actually be using it. You're still using it in a broader sense. And so, yeah, you want to make sure you have that continuous coverage and that you have the option to renew in order to have that continuous coverage for up to at least 4 years, if that's how long your program is. And all of our plans, our student plans, are designed again for that. So they're all renewable for up to 4 years. Some of them can be paid monthly. I can talk briefly about a couple of our popular student plans. Our student secure plan is designed to cover you for those like I call them new unexpected illnesses and injuries. And like I talked about before, it covers hospital stays, doctor's visits, prescription medications, mental health coverage. There is an option to add on sports for athletes, but if you are playing like recreational or intramural sports, that's covered automatically. And it comes in 4 different levels, so you can choose the level that fits your needs. And the benefits change at each level, and obviously the monthly price changes. But this can be paid monthly, which is a great benefit for students. So you're able to say, I want this plan for a whole year, but I want to pay monthly, which is really nice because many students don't have, a huge lump sum to be able to pay some of these premiums. You can pay a little bit at a time. And then alternatively, we have a Patriot Exchange plan, which has the same types of benefits and coverages. It has a higher policy maximum, which means that that's the total amount that insurance will pay on your behalf. And you can choose, rather than 4 levels, it's a little bit more customizable. You can choose the deductible that you want and the policy maximum you want, and your monthly or your premium cost will be based on that. This plan cannot be paid monthly. It has to be paid in full. So, it could be better for you depending on your situation. And then you can add dependents onto this plan. So that's kind of the major differences of those two. And then another just thing to mention is that when you do purchase a plan with us, you immediately get an email Usually it takes seconds, sometimes minutes, but you immediately get an email with your ID card and a visa letter. So if any of you do need to take to prove insurance to your school or any other entity, you'll have a letter that shows proof of coverage. And you can always digitally access these documents and anything else that you need through your Student Zone portal.
Awesome. Thanks, Leslie. That was really helpful. So let's say Arbaaz thinks ahead and says, I should have health insurance. So he goes ahead and he gets the student secure plan. He's studying the United States, and then maybe Arbaaz has what we would describe as like a minor motor vehicle accident or some other accident. Uh, and he says, "Oh, I should really get some care to check up any sort of medical services." What would he do going to the doctor's office or seeking treatment to like make sure that he can get the most out of his health insurance and that he can make it like a seamless, painless experience?
Try a lot.
I mean, as painless as it could be, Arbaz, considering. Yeah.
Yeah, I think it's so important to talk about this because it's easy to get focused on that, how do I actually purchase insurance? And then I feel like a lot of students kind of get stuck and don't actually know how to use their insurance once they have it. And it's not, once you've paid the premium, you're not done. There's still stuff you have to do to actually be able to utilize the benefits that you're paying for. So one of the very first things you should do is print that ID card that you get, either in email or whatever, however your plan sends it to you. Print it so that you have a hard copy in your wallet, and then keep another copy handy on your phone. Some people like to put it in their favorites or however you choose to save your things. But make sure you have that with you at all times because you just never know when you're going to need it. The next step is to understand the in-network provider process. I mentioned that earlier. So the way insurance works in the United States is there are in-network providers and out-of-network providers. So insurance companies have essentially deals or plans with certain providers, and so they get discounts, which then come back to you. So it's the most affordable way to visit the doctor when you use those in-network doctors. So how do you know who's in network? If your friend comes to you and they're like, oh, I saw this great doctor, and you're like, oh, that sounds awesome. Well, don't just go see that doctor. You either need to call them and ask them if they're in network with the name that's listed on your insurance card, or you need to actually do a search. And I'm going to real quickly show you guys how to do that, at least from our space. I'm going to share my screen. Okay. So when you purchase our plans, you get access to what we call the Student Zone. And this is a website basically where you can access everything you need. So it will look something like this, different depending on your plan. But you would go into your Student Zone and click Find a Doctor Hospital. For this student secure plan that you used as an example, Alex, United Healthcare is the network. And they're one of the largest in the country, so you're going to have a lot of options, hopefully, depending on where you are. So you'll click on that logo, and it's going to take you to the United Healthcare website, and that's where I'm going to show you real quick. So I'm located in Jacksonville, so just because I know that's where I am, I'm going to show you guys this as an example. Oh, can you see this? I bet you can't. It probably didn't open up the...
I think it hasn't popped up. Yeah, we
Yeah.
still see the Find a Doctor / hospital.
It popped up, but I have to reshare that correct screen. 1 second. Here we go. Here. Okay. So hopefully you guys can see this. It says, what type of medical care can we help you find? So this is the United Healthcare website. So if there's a specific doctor you want to search for, I'm just going to say, like, let's see if Dr. Smith is here. Okay, perfect. There's 23 Dr. Smiths near me, and you can, look and find the one that you're looking for. If they're not listed here, then most likely that means they are out of network. And so you would want to find a different option. If you are really hoping for a certain doctor, again, it's always best to call them because sometimes these websites are, sometimes they're not totally updated. So it doesn't hurt to call and ask. So you can either search by individual doctor or you can just search generally. So let's say you don't have a specific doctor you want to see, but you want to know like what's the closest place I can go that's in network. You can click on places. And then for this example, we would do clinic. You don't need to go to a hospital, maybe urgent care clinic. And then it will show you the different ones within, in this case, it's within 20 miles. You can shorten that or expand it, depending on how far you're able and willing to go. And you can see all of your different options that are considered in network for you. So that's just one example. That's one website, that's one network. But I think it's important for you guys to know and understand that you can do this. And it's important to try to stay in network. That is how you're going to get the most bang for your buck with your with using your insurance. And then lastly, you can always call, the back of your insurance card has a number, and you can always call that number and ask them about a specific treatment or a specific type of visit, and ask them if it won't be covered, or if it will be covered. So you'll have a policy number on the front of your card. They will ask you, and then they'll be able to look up your specific policy and tell you, okay, if you receive this treatment, this is, the estimate of how much it would be, or you know what, this isn't covered under your plan, so it's, you're going to be paying out of pocket.
Makes sense. Makes sense. So it sounds like with the in-network versus out-of-network, it's individual per policy and plan, but you can't really go wrong if you just start with the insurance website when doing your search.
Exactly.
Awesome. So now we know sort of how to proceed. Arbaaz, is this how you went about things when you availed your health insurance, or did you go through a different process? Just want to
Well,
hear it from the horse's mouth.
yeah, so what happened with me was I broke my elbow after falling down from an electric scooter. That's all we need to know about the injury. And I had a fracture in my I think, humerus or something. But I mean, to be honest, after I had this fracture, that's when I realized, you know what, I should take a printout of my card as well, because it's going to be needed in anywhere I go, right? So all of those things were definitely reactive in my case, and I did not have a very beautiful portal to find a doctor for myself. What I did was I asked a few of my friends who had, because thankfully I was studying in Johns Hopkins University, and a lot of my colleagues were doctors themselves. So they were able to refer a few names to me, and I did the same thing. I called them up, asked if they are available. I had a fracture already, so all of this is reactive. And the nearest date that I got from my calls was 20 days later, and that's not used to me at all. And that I think was the most frustrating time in this entire journey, because I was looking for an urgent care or looking for immediate attention to my injury, but wasn't able to get one. Thankfully, I was able to find another doctor in a different hospital 4 days later. But again, that was a 4-day wait in a fracture before you can actually get to a doctor, and they can then refer to the right test. I was able to get to an urgent care, a first aid thing, just to get some bandages in, but that doesn't help in a case of a fracture. And it still was a painful process. I think that part could have gone a little smoother, just to make sure that for me to escape a little bit of a pain, but it wasn't. And to be honest, I didn't even have a series of steps or anything, as you mentioned, the checklist, to actually know, okay, you know what, these are the steps that you need to do if I get into an injury, because nobody plans for it. And not just the doctor themselves, but you also, I mean, in a case of fracture, you also have a post-treatment therapy too that goes on for a couple of months. So this needs to be a place where you can commute easily and regularly too. So again, that's a whole process of finding the right therapy center for you. And if they have the necessary slots for you, because I'm a student, I have my classes from anywhere between 8 to 5. So I need to find a place which can offer me slots based, somewhere around these times, who could be a little more flexible on the days of these therapy appointments, so that I can choose which day do I need to go and get it done. It's a complicated process, and it definitely helps if you knew, or all of these things, or at least the series of steps that you need to take. In my case, everything was I would do as and when people would tell me, you know what, now you need to submit your insurance card. Now you need to book your appointment for your CT scan. And then I have to be on the call with my insurance provider. Is the CT scan covered or not covered? Oh, will it take 5 days to give you that confirmation? It can get messy if you don't know what steps to take first.
Yeah, absolutely. And I mean, you know, a little peek behind the curtain. Arbaaz and I are good friends. So, I know that you're also during your program quite busy and there's not necessarily a lot of time to earn an MBA and also uh, dust up on healthcare processes at the same time. So, totally.
And I
Exactly.
love what you said about how you had to be reactive. And so that's everyone who's here, you're doing a great job of being proactive. And as much as you can, if you obviously you can't prepare for the completely for the unexpected, but if you could familiarize yourself with the hospitals, the doctors, the like urgent cares that are closest to you, so that if you do need to use them, you can, okay, I have a list on my computer. I have a list like printed out next to my desk that you can refer to and feel comfortable. But also, if you need to go somewhere in an emergency, go. Please don't be like, oh, I have to make sure, like we want you to get the help that you need, and you can figure out the rest later.
That makes total sense. Okay, so now we know what kind of to do prepping for. When you're actually at the doctor's office or urgent care facility, what are some things that students should kind of just be aware of in terms of that same processy, like what to look out for, what is a copay, that type of thing? Think.
Yeah. So when you go to the doctor or the hospital, even the emergency room in the US, the one of the very first things they're going to say is, do you have your insurance card? So make sure you have that with you electronically. These days, it's usually fine. They usually have an email you can send it to, but just make sure you have a way to access it. Also, verbally confirm, even if you talked to them before, just say, do you guys accept this insurance, right? If you're in a situation where you have choices, if you're there at the ER and you need to be there because you're not breathing, don't worry about that. But it's helpful to just verbally confirm that. And then copays, like Alex just mentioned, you will be expected to pay any copays up front. So a copay will be clearly listed on your benefits from your insurance plan, and it's something that you have to pay every time that you visit a type of doctor. So depending on the type of doctor you go to, if it's a hospital or urgent care or primary care or specialist, you'll have different copays, and they range. It might be $25. For the ER, it could be as much as $200 or $300. So you will have to pay that up front before you've even seen the doctor, which might feel kind of strange to you guys, but it's just sort of the way the process works. And then if your doctor suggests any additional tests or x-rays or anything like that, you are always allowed and encouraged to ask, is this covered under insurance? And if they don't know, you can ask them to send the request to your insurance company and they will provide an estimate. Estimates are not always completely accurate, but it will help give you an idea so that you can make an informed decision. And then when you're checking out, so you always check in and then you see the doctor and then there's a checkout process. Ask if they can provide an estimate for the cost of today's visit. You most likely that they're going to send the bill to insurance if you've gone in network, so you won't have to pay that immediately, but it can be helpful for you to know what to expect. And then also ask for any paperwork that you might need to file a claim, which we're going to talk about in a few minutes.
Muted myself. But yeah, actually I'll ping that right back to you, Leslie. What is a claim and like how does the student and the insurance company come together to like pay the bill essentially?
Yeah, so claims process is, I think, where one of the biggest like pitfalls that students run into with insurance. With most international student insurance plans, there is a claims process that requires action on your part. So after you visited the doctor, you have to do what's filing a claim. And this is essentially you reporting to the insurance company that you have received care and you want them to help cover it according to the benefits that you pay for. If you do not submit the claims paperwork, they will say, oh, well, it's, I guess they're just taking care of it. So it's really important. It's like a trigger for the insurance company that says, okay, they want us to actually help support this, which seems silly maybe, but it's just the way the process works. So you have to file, typically with most plans, you have to file one claim per injury or illness. So you don't have to do it every time you visit the doctor if you're visiting the doctor for the same thing. So in Arbaaz's case, that fractured elbow, just the one time you send a claim and say, I fractured my elbow. So every visit related to that fractured elbow, including x-rays, prescriptions, and actual doctor's visits, is going to fall under that one report. Like that student zone I just showed you is another place you can go to get claims filing instructions. Every company is going to do it a little bit differently and have a different document. So I can't just give you a general way to do it. But they are usually really helpful. You can always, at least for us, if you purchase one of our plans, you can always call us and ask for help with the claims filing process. We're happy to walk you through that. So after filing a claim is essentially paperwork. So after you've done this paperwork, you're going to want to check back for updates. Usually they say 30 days is the time it can take to actually receive a response to that claim. So if it's been more than that, you are always welcome to call and get an update. You want to call the insurance company to get that directed information about your claims. Like we don't, unfortunately, we're kind of in the middle, so we don't always know, we don't have a way of accessing your claims data, but we can help you communicate with the insurance company if you need to. Once you get a bill, this is super important. So aside from claims, once you actually get that bill, so after you filed the claim and you receive a bill, please, please, please look at it. If you can't make heads or tails of it, you can't make sense of it, then ask someone else to help you, maybe even like a local, like a US, a domestic student. They might be able to help you navigate and understand it a little bit better. You could always take it to your health center as well and ask them to help you. But if the description of what you're being charged for doesn't seem like it matches what you actually received care for, then don't just ignore it. You should make a phone call to your insurance company and say, this doesn't look right, because I always like to remind students that humans are the ones putting in this information, and humans make mistakes, and it's just numbers. It's a coding system. So if they hit a 1 instead of a 2, then that could be a completely different thing. So make sure you're checking that bill really carefully. And then once you've confirmed your bill is correct, if the cost is not something that you can pay right away, you can always call wherever you receive care. So the hospital, the doctor, that's where the money's going to. And so you can always call them and say, hey, I cannot pay this entire amount right now. I need to set up a payment plan. You can also ask them about discounts that might be available. You can tell them, I'm an international student. My insurance plan is not, doesn't cover this as well as I want it to. Do you offer any discounts for someone in my situation? It never ever hurts to have those conversations, and medical debt does not accrue insurance. I mean, I always say that, interest. So it's not gonna become bigger. As long as you're paying on it, it's going to prevent it from going to what is called collections agency, which is not a situation you guys want to be in. It's not good for your credit. And it makes it harder for you to be here. So it doesn't hurt to ask questions about your bill. That's kind of the summation of that.
Yep. Makes total sense. I think sounds like the take home point and kind of the theme for today is, although there might be individual policies or like individual companies do things one way versus another, generally you can't go wrong by reaching out and asking for assistance and clarification where you can, especially given how complicated medical stuff can be.
Yes, and we, as well as many other, like a lot of the insurance companies, have multilingual customer service available.
Awesome.
So if you feel more comfortable talking about this stuff in your native language, hopefully that can be provided for you. Because I know it's tough to talk about some of these complicated medical things in a language that's not your first language. So
yeah, definitely. That's awesome support for international students. Speaking on the topic of communication, Arbaaz, I wanted to ask you, so obviously this is a little bit tangential, but we have the health insurance side and we also have the student side, So when you had your elbow treatment, how did you coordinate with your school? Like, in other words, did you reach out to your school based on your health status at all, or did you handle it like, totally internally?
No, actually, I had to because my injury happened 6 days before the new session was supposed to begin. So very much, I would be taking the fracture in the new session as well. But thankfully, there is every university. In fact, I think most universities would have a student disability center. If you were unfortunate to get into a similar injury like mine, you might have what we call a temporary disability, which might hinder you to perform your roles and responsibilities as a student in the school. That is where you reach out to them, ask for an accommodation wherein based on the kind of injury that you have, which is hindering your abilities. In my case, I wasn't able to type. So what they offered me was as text to speech to text software, a license for that. So a lot of my assignments, because it's an 8-week term, and my recovery was supposed to take more than that. So technically, I was supposed to sit in the exams and take them with a broken hand. And that's where the tools come in handy. But it's very important because your graduate programs are very quick. Either they are 1 year or 2 year. And if you lose out, or at least if you fall behind because of any injury and a healthcare, you don't have anyone else to blame. That's the story of it. So make sure that you are communicating it very well. Even if it's not just university, you might want to talk to individually to each of the professors because they are the ones who would be marking your attendance, grading your assignments. And you don't want to get into a situation where after the results had been declared, you're going back to your professors and asking them, well, I had a broken arm, I couldn't write, and
Yeah.
could you
Yeah.
increase my grade now? Instead, be a little proactive and not reactive, as that's been my constant messaging throughout the session.
Yes, yes,
But you
yes.
want to communicate a lot of those things to your university, to your program manager, whoever that might be.
Mhm.
That's very important because the treatment would go on for some time, and there might be days where you might have to go into rescheduling one of your therapy sessions or one of your classes because it clashes with a therapy session or a doctor's visit. So make sure that they are aware of your situation, and you don't really have to explain yourself again and again to a professor or to your faculty or a student affairs about, well, I need some time to get to the doctor. That's definitely true. In my case, thankfully, the medicines weren't too expensive, and I was able to get some of them delivered from India as well, so through some of my friends. So that kind of happened. But I know a few of my colleagues who have been into the situation where they had to go for and buy medicines from one of these big pharmacies. They definitely needed clarity on how to get that going,
Yep.
how to go for the prescription. How does the communication happen from the doctor's clinic to the pharmacy? How do you keep a track of all of those things? And Leslie, maybe that might be an important aspect to talk a little bit about it. I don't have an experience on getting the medicines from a pharmacy, but I'm assuming that anybody who gets into a situation where they have to use their insurance might have to. So
Yeah.
maybe we can talk a little bit about that.
Yeah. And I want to add on to that question or specify it a little bit more. When it comes to prescriptions from your home country, I mean, obviously, Arbaaz sounds like you had some help, but if you're coming over, can you generally bring prescription medication from your home country, or is that a leave at home and get in the United States type of situation?
That's a
It,
good question.
it completely depends on the medicine. So there are some medications that the US doesn't allow to come in. They might allow if you have a doctor's note. So that would be something to talk with your DSO, your immigration advisor about, and they might work with the health center to determine what that process needs to look like for you. If you're already in the US and you're wanting someone to either ship or bring medication for you, then that's kind of another issue. But it really depends on the medication, but it is possible. But there's a lot you can get here. The other thing, I know some carriers have tools on their apps where you can see like the equivalent because medicines are called different things.
Yeah.
And so you can see what the equivalent is in the US. So it might not be that you might think, oh, they don't have this in the US, but it's actually just that we call it something different. And some things are over the counter in the US that are prescription in other countries and vice versa. So there's just a lot of variance in if it's something you take regularly or something that when you're here, your doctor tells you to take. That's another great question is to ask. Like, is this a prescription or can I just go pick this up at the pharmacy? Or is there an option, like maybe, like for example, allergy medicine, there is
Sure.
prescription allergy medicine. It used to all be prescription and now you can get it, a lot of it over the counter. So just kind of depends on what you need.
Yeah, makes sense. And then just to clarify one more sort of related point, prescriptions, case by case, health insurance plans, generally speaking, the student will not be able to use any health insurance plan from their home country, right?
Yeah, I'm glad you said that. So that's something we get questions about a lot. And a lot of times when schools don't have very strict requirements, a lot of times that's what students end up doing is saying, oh, well, I just kept my insurance from my home country. But because your insurance is designed for your home country's healthcare, it doesn't cover what it needs to cover when you're in the US. As we tried to explain a little bit, healthcare in the US is extremely expensive, and so your home country healthcare is, or home country insurance is not going to cover enough of what you need it to cover in the United States, and it will likely end in you having a lot of out-of-pocket costs. So it feels like a cost savings. And if you could, wave a magic wand and never have to use the doctor while you're here, then that would be great. But it's not really a good safeguard. And yeah, with prescriptions, that would be a complete guess. Like I would have no idea how those might or might not be covered. And prescriptions in the US can be very, very expensive without insurance.
Yeah, definitely. Definitely. I can co-sign that one. Um, so okay. So say going back to like the four types of insurance, so the mandatory with waiver, mandatory choice, and optional. If the student has their own choice of health insurance, um, how would you go about finding that waiver, generally speaking? Like, in other words, to waive the school health insurance, who would you talk to at the school in order to coordinate that?
Typically schools are going to have everyone puts health insurance in a different office, so it's hard to say. It depends on where it lives, but typically they're going to have a website that will explain this is our health insurance plan. If you want to waive it, here are the waiver requirements. And then usually it depends again on the school, but a lot of them use like a portal. So you have to go into the portal and submit all this information. They are going to ask you very specific questions about the insurance plan that you are waiving with. And so you need to make sure you have all of that information. Some of them do require a form. So if you purchase our plan, for example, they would you would send the form to us and then we would sign off on it saying, yes, this person has purchased this plan, it meets these requirements, and then you would provide that back to your school. But how to find it and how to go about it, again, it's like really specific to the school, but we can help you with your waiver process if you're using our plans. So
Awesome. Good to know. And then I see we have one question in the chat. Just want to revisit. So, for pregnancy or obstetrics related, giving birth, um, that would fall under the maternity care that is optional for the Student Secure and Patriot Exchange, correct? So,
yeah, so well, the Patriot Exchange, I believe, doesn't actually have maternity care. So if that's on your radar,
okay.
that would not be a good plan.
Mhm.
But yes, Student Secure does have maternity options on the top 3 levels. And so if you are thinking of getting pregnant or think you might become pregnant while you're studying here, then that would be a good option for you. It's important
Mhm.
though to distinguish that you cannot already be pregnant. If you are
Mm-hmm.
already pregnant and you purchase a plan, that would be considered a pre-existing condition, and it's not going to be covered on that specific plan. If you are needing that type of coverage, and you have the option to take a school health insurance plan, that's probably what you're going to want to do. because most likely that plan is more comprehensive. It's probably also more expensive, but it will protect you from those high birth costs that happen in the US. Unfortunately,
makes
childbirth is
sense.
quite expensive in the
Sure.
US.
Yeah. Well, a lot that goes into it, I think.
Yeah.
But okay, that sounds good. And that kind of leads into our original point of like when you're shopping for a plan, if you have your specific situation, that will affect like, when you're shopping for a plan, it's not like one plan for all international students. There is, like tailoring that you can do to find a good plan for your specific situation.
Yeah, and we always recommend if you're shopping with us, so if you're using the internationalstudent.com/insurance website to find insurance plans, and you are like, oh, I don't know which one to pick. I'm really confused. I have this chronic illness or I have this happening and I want to make sure it gets covered. You can always contact us. So I believe it's insurance@internationalstudent.com is the email. And you can just say like, hey, I have these questions. I want to make sure I get a plan that covers this, this, and this. And we can help you find the right plan. And if we don't have it, then we'll obviously let you know that too. But yeah, we can kind of help you navigate it because it is a lot to navigate. So we're here for that.
Awesome. Awesome. Yeah. Well, we are coming to the last couple minutes of our webinar. Just want to say thank you guys so much for sharing your knowledge and experiences with the audience. I just wanted to close up with a real quick, simple question, which is, Arbaaz, we can start with you. If you wanted to have our audience take one thing away from this webinar, just remember one thing from it, what would it be?
The job doesn't end at buying the insurance. Make sure that you
Yeah.
know how to use it. I think that would be my biggest learnings and suggestion I could give to any of the fellow international students. It's important to know what does your insurance covers and how will you use one. So yeah,
Yeah, short and
thanks.
sweet. I appreciate it. Of course. Leslie, I'll pitch the same question to you.
Yeah, for me, it would be ask for help. You are not
Definitely.
expected to know all of the answers, and we are here to help you. And so, so is your immigration advisor. So are lots of people. We're all here to help you. So just ask the question, and then you can be guided in the right direction.
Yeah, absolutely. I think great advice. Also, I think true across all aspects of your international study. If you're an international student, it's a complicated process, but the good news is, pretty much at every step of the way, there is a supportive community or institution that like really wants to help you succeed, whether that's in health insurance, admissions, financing, etc. So it's a nice international community. But guys, I think in the last minute of our webinar, once again, thank you guys so much for offering to share your knowledge with the audience. And to the audience, thanks for attending. We really appreciate your time.